It affects you in a way that is difficult. It's difficult. You go to bed at night and you pray. You're like, God, just give me the strength to wake up and go and do my job every day. It's up to you to protect me, because at this stage, you don't know what protected the other people and what didn't protect these people. There's certain genetics that, I don't know what my genotype is. I don't know what my risk factors are. I don't know why that person got, severe COVID-19 pneumonia and died. I don't know if I have that, genetic makeup that made that person die, because, I haven't examined myself, that far. So mentally, it is exhausting.
It has been an emotionally draining year for Dr. Thobisa. Working in the ICU ward means she's at the helm of this virus, having to decide who gets a ventilator and who doesn't.
It's challenging. It's challenging. I've seen my colleagues cry. People who you would have thought, have got it together, and you've seen them cry and you've seen them break down, and you realize this is actually real. It's real for you, and it's real for other people as well. So mentally, it has been the most taxing time of my academic and working life.
A medical doctor for over 10 years, no academic research or practicals could prepare her for this. With other illnesses, ICU patients normally survive, even after being in a coma. But with this virus, what traumatizes her most that many times her patients interact and she gets to know the person behind the virus, only for them to die minutes later.
I'm sure a lot of people are aware of the studies that were done previously that showed that COVID used to affect the older population. It used to be the the older persons in the community. But now in our caring of these patients, we're actually seeing young people. We're seeing young people come in very ill with COVID-19 pneumonia, and we've seen people die from COVID-19 pneumonia. So it is actually very true for us, where in the past, when it started, we were like, no, it's all the older people who are, succumbing from the disease. Now you realize the amount of risk that you are at every single time you interact with a COVID-19 patient. You wear the PPE, and sometimes you wonder if you are wearing it, if the PPE is going to protect you from contracting the virus. But what else can you do? I mean, you went into medicine knowing that, some of these things may happen. But now when it gets real, you see your colleagues getting the virus, you see people around you getting the virus, then you realize that, the threat is real. One day I may have a cough, and the next day I may need a ventilator, and it may not be available.
Dr. Kevin calls his COVID ward the dungeon. It is a place where only the fittest survive.
I definitely feel it. It's not nice to see people suffering, very short of breath and unable to get oxygen, or you struggling to find oxygen for them. And also knowing that a lot of these patients that are coming in are older, they have comorbidities, and the reality is they're not going to qualify for any escalation of care. And that's hard to accept.
Many a times resources and staff personnel were scarce or insufficient, putting more strain on his already exhausted state. Mentally, he's coping the best way he can, and more concerned about junior staff who are struggling with all kinds of psychological issues.
I think everyone's got their way of coping and way of dealing with it. It obviously knocks you as a healthcare professional when you as a carer, someone who's gone into medicine wanting to help people and really be there for them, and when you find yourself in a situation where you can't do that, it's quite demoralizing. So my ways of coping, I've got quite a good family support. So I go home, I've got a wife and 2 kids, and a happy home. So when I go home, I unwind. It's a space for me just to relax and then to come back to work and to be able to do what I do.
But it's not all doctors who coped with the demands that come with being a frontline worker during this time. A doctor from Dorangenza Hospital, which was plagued by protests by doctors, nurses and staff over the inhumane conditions at the hospital, says he has lost hope and is leaving to another province.
Understaffed, and even we don't have working computers, x-rays, and also in the x-ray department they must wait for a certain number of patients so that they'll be able to take them as a bunch, because they don't have PPEs. So that also affects the patient. Secondly is the pandemic, the COVID. People are dying here. As I said, we're understaffed, we're overwhelmed by the workload, and also dead corpses are lying around here. It's even smelling with a bad odor. So today we decided to put tools down. So we demanded to see the CEO, but we were told that no, he's not available. When I go back 2 weeks ago, we handed a memorandum to the CEO and the clinical manager. Until and to this date, there's nothing, there's no response. So we are in crisis in Port Elizabeth, Dorangenza.
A third of South African doctors surveyed by the Medical Practitioner Society have experienced a decline in mental well-being as the COVID-19 pandemic progresses, and will need specialist support to avoid huge bands of doctors either leaving the profession or suffering in silence. Staff psychologist Dr. Kempi van Rooyen, who has counseled many doctors during this pandemic, says doctors must be given time off like everyone else.
I've actually been encouraging doctors to take your breaks, go home when your shift is done, leave COVID at the hospital. You need space away from actually having to function in that role where you are taking responsibility for lives, often with the resources not being as available as you want them to be. So as strange as it may sound, is if we want to preserve our doctors, we've got to be kind to them, and we've got to give them time off as well. So in terms of things like leave, it sounds strange when we're heading into our peak, but we cannot have some of our main soldiers become depleted during that fight. We also need to give them time off.
With the country now in the second wave and a new variant causing much scare, there's also a call from doctors for government to improve working conditions at hospitals, such as employing more staff, nurses, cleaning staff, porters, and get more resources such as ventilators, all of which they say will lessen the burden on them, both physically and emotionally. Lerato Fekisi, SABC News, Port Elizabeth.